So I've had the pleasure of working with Cherie Erkmen for the last 5 years on the Committee for Wellbeing with the AATS. I mean, she's a phenomenal and very powerful woman in cardiothoracic surgery, and you know, she's going to present her work today, which is really an incredible study and very important for us to understand and pay attention to. It's entitled "The Cost of Being a Woman in Academic Cardiothoracic Surgery: An Analysis of Academic Rank and Salary." Dr. Erkmen.
Thank you for the kind introduction, and thank you to the STS for giving us the opportunity to present this collaborative work between the workforce of diversity, equity, and inclusion and cardiothoracic surgery practice models. I have no relevant disclosures, and we heard about financial wellness. I would say that it begins with being compensated fairly. What you're paid is what you're worth. It's an oversimplification, but what are women worth in the U.S. workforce? According to the Department of Labor, the United States Census Bureau, women are worth 83% of what men are worth. For every dollar that a man makes at the same job, a woman makes 83 cents. This is better than in the 1960s when my mother was working, where it was 60%, but we still have a lot of work to do. So our purpose was to quantify salary differences, if any, between cardiothoracic surgeons who are men and who are women. We used cross-sectional data from ACGME, AAMC. We looked at 2019 to 2021, and we stratified it by academic rank. So our results are this, that women earn anywhere from 77 cents on the dollar to 84 cents. So for instance, let's spend a little time on this slide, that if you are an assistant professor, you are a woman, you will earn 84 cents for every dollar that your male colleague earns. And you can see as we progress through our academic ranks, that disparity is larger. Unfortunately, this is not unique to us. In all medical specialties, in all surgical specialties, we are between 75% to 80% of a man's salary. So let's get back to cardiothoracic surgery. Women earned less than men of lower academic rank. I'll say that again. Women earned less than men of lower academic rank. Female professors earn 90% the salary of male associate professors, and female chiefs earned less than male professors. This is not the case with chiefs who are male. They earned 128% of what males earned in the professor rank. So I'd like to present this in a different way, is this concept of equal pay day. If you have two surgeons, one a man, one a woman, cardiothoracic surgeons working all of 2022, and the man gets paid. For the woman to earn what the man earned, she would have to work all of January of 2023, all of February, and into March. A woman would have to work until March 18th, 2023, to equal what a man made in 2022. So our male colleagues are not sitting around. They're well on their way to earning the income of 2023, and women are already behind in March. So you can see how this balloons, that this gets worse and worse, and it accumulates. And when you think about accumulated wealth, what does that mean? We heard about repayment of loans, so that would be harder for women. Interest, the opportunity to invest this money, all of this compounds this problem. And the AAMC published this very nice work looking at promotions. So this is a really important concept, that women are promoted at a slower rate than men. And so even if we could equal those salaries, because of the slower promotion, women have fewer years in that high earning bracket. So the limitations of this study were that we just looked at academic faculty salaries. There's no reporting of subspecialties between cardiac and thoracic and congenital. It only covers 3 years, and it spans COVID-19. And we heard that there are several mechanisms of compensation, and we just studied salaries. So everything that you heard about clinic resources, access to patients, complicate this story. And similarly, there are several mechanisms of disparity. So our next steps are to request more granularity of data from our sources and through our STS means, hopefully through a survey that goes out. The next survey, it must have salary data, and please fill out the survey. Continued collaborations of our groups, guideline compensation, and standardization of salary. Now, what does this mean? I can sense some shifting in the chairs. We already do this. We already do standardization of salary. Think of our chief residents. So it doesn't matter if your chief resident is a male or female, good or bad, that person is paid the same amount. And you would be appalled if I told you, well, next year, if your chief resident is a woman, pay her 84 cents on the dollar. You would be appalled. However, that's exactly what we're doing when she graduates to be an assistant professor. That's exactly what we're doing. So, in your heart of hearts, you have to think about this. The woman who you recruited, who you trained, who you graduated, mentored, hired, and perhaps is sitting back at home while you're here at this meeting, that person, is she truly, truly worth 84% of what her male colleagues are? If the answer is no, what can you do? And so I like to think about things in terms of levels of influence. And so at the individual level, you can speak up and speak out. Everyone here has talked about transparency. Educate yourself, educate others. You, in your institution, can be a part of these promotion and compensation committees. You should demand transparency and develop metrics that are meaningful. In our thoracic surgery societies, we need research, we need guidelines, we need collaboration. And in the global environment, as we talked about, this is not just among cardiothoracic surgeons. This is across all sectors, and we need cross-sector collaboration to solve this problem. So our take-home points are that women earn 77% to 84% of what men earned. The problem is complex and multi-level, and we need everyone to help. And just a little bit about myself. This is my 90-year-old mother. She was a working mom in the 60s. She was earning 60% of what her male colleagues were earning. I'm earning 80% of what my male colleagues are earning. And this is my 9-year-old daughter. And my hope is that when she enters the workforce, that she will be paid what she's worth. Thank you.